Dr. Tural, can you tell us a little bit what a mom could and should do when a 2, 3, 5-year-old, 10-year-old for that much or older comes in and has, hurt himself, fell down, got a little bit bleeding, skin all scratched up, or maybe a bigger cut? What are some of the first things, mom could do, should do, with such injuries?
Mm-hmm. Well, the injuries of minor scratches and bruises and what have you are things that they can handle in their home. But what they have to pay attention to is the nature of the fall, and then if there is any more serious implication to that fall. Every serious injury to head or other body parts, especially the head, would involve a loss of consciousness. The child would pass out, and only they would return to regain their consciousness. But that would be a serious warning for a parent to act on that, because that impact is, by definition, is a serious impact when they pass out on impact. And then they have that child needs to be checked in a doctor's office or in an emergency room to make sure that there's no emergency that happened as a result of that fall. Minor scratches and bruises, they can use over-the-counter antibiotic preparations and clean the area with soap and water, and they can use gauze to dry it, and then they apply the ointment, and then that would be it. But sometimes a subtle injury into the abdominal organs, like spleen, in an impact that could be ruptured, and if a mother is not careful about that, then that child could bleed internally and then could lose their life. So with that, it is not the surface scratches and bruises that they have to be just checking on. They would need to check on their breathing and pain in the abdominal area, and then loss of consciousness. That's very important. Those are the things they have to make sure that they do check on and get the clearance for those things before they apply they clean the bruises and scratches and apply the ointment.
Okay. So basically the child falls down, cries, comes in, has a whole bunch of scratches on it. Yes, you look them over, you see, but you look beyond the surface scratches and see what else could happen. So how do you do that? You ask the child, did you fall down? Did you hit your head? And you basically check the head and do things like that. Yep. And if you see any bruises there, you're telling me you're better. I mean, you don't know if the child was unconscious, and if he was unconscious, he probably doesn't know, because by definition he just was unconscious. Right. He doesn't know that 2 minutes passed by since he woke up again. Right. What would you do? You just say, well, let's go to the doctor and let's check, or you observe the kid whether he's stumbling, or what do you do?
Right. The examples I gave were more serious falls. Like a child is running and then tripped and fell. That would never produce something of that magnitude, unless, of course, a child hit the side of their head on a sharp object or a blunt object that would add a different dimension to that injury, or the child fell onto something that is sort of where their spleen is. and a blunt object went into the spleen and damaged it. So those would be different case scenarios. I'm talking about a child who's falling down the stairs and then found unconscious, or a child is unconscious at the time, at the place of impact, and somebody else observes it and then goes to help the child. Those kind of cases where there's a known loss of consciousness is what needs to be brought to the attention of a doctor.
Right. And so, I remember when I was growing up, there was always this, I hurt myself a lot. I grew up a little bit in a forest kind of area, and I was playing with all kinds of things, including stepping at rusty nails. So it's there, at the over-the-counter antibiotics these days, I'm sure they changed a lot from back then. Back then, I remember iodine was one of the major things which Mom constantly put. I mean, I think she had 3 gallons of that ready for me at any given time. but I'm sure there's, these days it's better and other things. So are those wound cleaning antibiotics over the counter, are they usually doing all the job and you don't need to worry too much about the child getting an infection of whatever he or she hurt himself with?
The superficial cuts and injuries are nowadays we deal with those by doing proper cleaning. Soap and warm water will do, or water will do, and then applying antibiotic ointment is also optional at the end. When you have rusty nail and deep penetrating injuries that are going beyond the skin into the tissue, that would be a real risk for tetanus or other germs being penetrated into deeper layers of the body. Those would have different implications. Those kids need to go to their doctor and then need to get their tetanus shot update and need to have an antibiotic treatment to stop the progress of that potentially life-threatening infections. Superficial ones are cleaning and applying ointment of antibacterial nature.
Okay, good. So if it's just the skidded stuff, just fix it up, don't worry too much, it will kind of come back, everything will grow fine, there'll be, but if it goes into the flesh, another thing, yes, go and look, and go to a doctor, go to an emergency room, because it might have more, and it's better to be careful than to be sorry.
Right.
Well, all right. Here you have it. Thanks a lot, Dr. Tural.